Well, if we bring these things in, can they have an impact? There was a study released this year in the Journal of Patient Safety by one of my colleagues, Jeff Dusick, and a team from Alignus Healthcare located in Minnesota, which took a cohort of 1,800 patients. It was a retrospective and observational study over a year, and they had an integrative management team enact treatments. Now, they could have hypnosis, they could have guided imagery, they could have acupuncture, they could have aromatherapy. This study looked at this, but it wasn't important in trying to figure out if there was a change. Their intervention was really to see if there was a reduction in pain, pre and post initial interventions. And what they saw across the board was that no matter whether the pain intensity was 2 out of a scale of 0 to 10 or 9 or 10, there was a 50% reduction, and it seemed to hold. Unfortunately for us, they had the, well, unfortunately for them, they had the luxury of having a very unique inpatient infrastructure for their team. All of these people were on salary, and they were able to work as a unit for an entire year. In other words, they had an integrative management pain coordinator. God bless you up there, sneezing. So I'm going to diverge a bit and talk about something that you know very well, and that is stress. And I just wanted to remind us that this is sort of a subconscious reaction. It takes a tenth of a second for us to sense pain at a subconscious level and then train our whole physiology to do something. And that's good, because if something's running after you, like that poor cat who could have been chased by those German shepherds, boom, if he couldn't enact quickly, he would have been gone. So in terms of stress, things have changed over the years, especially over the last decade. And every year, the American Psychological Association does a survey on stress, and they always come up with very similar numbers, at least in the last 5 years. About 80% really of their recipients in this survey admit that they have stress, and they understand that it can make them sick, yet only half are concerned about their stress level. And of those who are having excessive amounts of stress, now this is on a scale of 0 to 10, they're rating their stress between 8 and 10. 82% of those say that they deal with it very effectively and they're managing it. Yet if people take a deeper history, what they find in those is that half of those 82% are actually trying to manage a problem that they may be seeing me, primary care physician, for, or even you. They're having irritability and anger, fatigue they can't manage, headaches, insomnia, decreased sex drive, irritable bowel syndrome, dizziness, feeling like they could cry, and I could go on and on. What's striking about this is that everyone doesn't react quite the same way, but it's sort of split. There's about half, and I see this in my practice, who actually have more physical symptoms and have no awareness of any emotional distress, although they are actually stressed when you come to survey them in a more deeper manner. In terms of women reacting and men, it seems that women seem to have more physical symptoms. Those most typical are having sleeping problems, overeating or undereating, or using some kind of prescriptive medication to manage the stress. In other words, dealing with anxiety or nervousness or panic. So what do? You have not a lot of time. You're trying to figure out if you have a lot of stress, a little bit of stress. I put up the name of the most well-known instruments for assessing stress. The Holmes Life Stress Inventory looks at like seminal events that are really very distressing, like loss of a child, loss of a husband, divorce, etc. The Perceived Stress Inventory is a little more generalized. Job Stress Inventory looks at job stress. The Moloch Burnout Inventory has 3 different categories, but it's mostly focused on burnout. It has a general survey, human services survey for healthcare practitioners, and then an educator survey. I also put together a super stress questionnaire. And the reason I put it together isn't because any of these other ones, which are standardized, which mine is not, aren't effective. It's that the physical component with the lifestyle management component, with burnout aspects, and with perceived stress are not amalgamated into one inventory, so we need one. And I ended up making one, and I bring it up because you may find it useful. The first half of that survey is actually on an iPhone and on a website, and it's free, and it will be tabulated as you're taking it on the website, and that's the website down in small print. The other thing that's really wonderful is that this text, or this book, is actually available in Spanish. So if you go on Amazon.com under a Spanish name, you can get it. In the book, I typified 5 stress types. And that was an amalgamation of coping and resilience styles. Why did I do this? You know, I end up talking about lifestyle management along with stress over and over and over. And there's so many aspects to deal with, you know, diet, lifestyle, that I found that having a picture of a type was easier for a patient to get as a gestalt, an overall picture, than it was to label all of the things that define those types. So you know, you are very familiar with this, I'm sure, in terms of coping styles, dealing with people with chronic pain, but you might find this categorization very useful. So what happens when we have a stress response? We have the hypothalamic limbic area, you know, triggering a whole set of release of chemicals, adrenaline, norepinephrine, cortisol, etc. We also have a predominance of the sympathetic overdrive, the so-called, you know, drive to fight or flight. In the definition of the fight or flight response or the acute stress response, there is this concept now that maybe freezing or fainting may be part of that equation. So why name this? I mean, we've been living with stress since we evolved as human beings. And the reason is life isn't what it was. You know, your grandmother's stress is not the kind of stress you're dealing with in your own lives even. Many of us don't take our vacation time. 66% of us read our emails 7 days a week and expect to receive a response. 61% continue to check their email while they're on vacation. 56% have anxiety if they can't access their email. And words like crackberry are now part of our vocabulary. And you know what that means. So life has changed. We've accepted some of these changes without really thinking about the implications. And we've left out a very integral aspect that would have helped us recover. That's the downtime, the sleeping, having time with our friends. So what it means is that we've overtaken our capacity to bounce back. Our resilience has been very severely eroded. And I think we have to mention some of these things that I'm talking about with our patients. Even, remember we saw that research article that suggested that increased anxiety, you know, diminishes your effectiveness in pain management. Well, you know, it takes about 15 seconds for any one of us to suggest that if someone has a cell phone or a computer or a BlackBerry, I have a BlackBerry, that we have new rules. We turn it off at 10 o'clock. It stays out of our bedroom. We don't use it during meals. And we don't turn it on until 6 o'clock in the morning, 7 o'clock in the morning. You would be amazed at just even with that one intervention, how much that can augment the relaxation response, which, as you know, will reduce pain. So I put up this picture of a split brain just to emphasize for all of us that not only do we have a very effective communication system with the limbic system and the cerebral cortex, which helps us enact and recognize danger, but also I want to mention that the afferent tracks, the tracks coming from the limbic system to the cortex, are far more than the tracks, the neurological pathways going back into the limbic system, which means one thing. If you understand that you're stressed and you reason with yourself to do something, that doesn't necessarily mean that you're going to be effective in enacting a relaxation response. I also see that over and over. it means for all of us as physicians and healthcare practitioners enacting a multidisciplinary response that we actually have to find modalities that bypass the cerebral cortex and actually enhance body somatic awareness of relaxation. I cannot tell you how many people I have talked to who have been extremely stressed, needed pharmaceutical agents, understood that they needed to relax, tell me they can't remember how to relax.